Stop. Don't just listen to this video. Do one thing right now. Sit up straight, take a slow breath, and pay attention to what your body is feeling. Because if you ignore this, nothing I say today will help you. I've spent over 30 years as a urologist working with men in their 60s and 70s, and I used to believe what most doctors still say, that decline is just part of aging. But a few years ago, something happened that shook that belief. A 71-year-old patient looked me in the eye and said, "Doc, everything still works, but it feels like the life is draining out of it." That phrase stayed with me because I had heard it before, many times. These men weren't sick, no major disease, no new medications, but they all described the same thing: slower response, weaker firmness, less sensation, like the connection between their body and their mind was fading. What surprised me was this. When I dug deeper, it wasn't age causing it. It was habit. I went back, reviewed cases, tested patterns, even challenged my own assumptions, and most of what we tell men didn't hold up. The real issue wasn't testosterone. It wasn't even circulation alone. It was how daily private behaviors were quietly disrupting blood flow, nerve response, and hormonal balance. And today I'm going to show you the 7 most common mistakes I see. Mistakes that look harmless, feel normal, but slowly reduce blood flow over time. And mistake number 6 is the one almost every man gets wrong. Before we go any further, let me ask you something simple. How old are you right now? I read every comment and it helps me understand what men at different ages are really experiencing. Go ahead and share your age below. Now, let's begin with the first mistake that could already be affecting your blood flow without you realizing it. Mistake number 1, dependence on high-intensity visual stimulation. Let me start with something simple, and honestly, most men overlook it. For the next 7 days, try this. No screens, no explicit videos, no fast-changing visual stimulation. Just allow your body to respond to natural touch slowly without rushing. It sounds almost too easy, right? But this one shift alone can begin to reset how your brain and body communicate. Here's what's really happening behind the scenes. As you age, especially after 60, your brain's dopamine system, the one responsible for pleasure and arousal, becomes less responsive. When you rely on high-intensity visual content, you're flooding that system with more stimulation than it can handle. And over time, it adapts by becoming numb. Some clinical observations suggest that reducing overstimulation can improve sensitivity and arousal response by up to 25 to 40% over several weeks. Not because you're adding something new, but because you're removing what's overwhelming the system. Now here's the dual benefit most men don't realize. When you reduce this kind of stimulation, you're not just improving sensitivity, you're also restoring healthier blood flow patterns. Why? Because arousal becomes more gradual, more natural, and that allows blood vessels to dilate properly instead of reacting in short, forced spikes. Think of it like retraining your body to feel again, not just react. So here's how to do it. Start with 7 to 14 days of complete reset, no visual triggers at all. Focus on slower pacing, deeper breathing, and paying attention to physical sensation rather than mental imagery. You don't need perfection, just consistency. Over time, your nervous system recalibrates, and many men begin to notice stronger response, better control, and more lasting sensation. But even if you fix this, there's another habit, much more physical, that could still be restricting your blood flow every single time without you realizing it. Mistake number 2, pelvic compression from poor positioning. Now here's something even more physical, and often completely ignored. The first step is simple. Stop using positions that compress your pelvis, especially sitting hunched forward or on the toilet, and instead shift to either a standing posture or a slightly reclined position where your hips can open naturally. It may feel like a small adjustment, but from a physiological standpoint, it changes everything about how blood flows through the pelvic region. Let me explain the core mechanism. In modern medicine, we know that erections rely heavily on unobstructed arterial inflow and proper venous trapping, but both of these depend on one central factor: pelvic circulation. When you sit in a compressed position, especially with pressure on the perineum, you're restricting key blood vessels and irritating nearby nerves. Traditional Eastern medicine has long described this area as an energy gate, where stagnation leads to dysfunction, and interestingly, modern imaging studies now support that prolonged sitting can reduce pelvic blood flow by up to 20 to 30%, while nerve compression over time can impair signal transmission by nearly 15 to 25%. There's also a compounded risk here. Age already reduces vascular elasticity, and when you add mechanical compression, the effect becomes synergistic, meaning the combination is worse than either factor alone. That's why men over 60 who maintain these positions often report not just weaker response, but also urinary symptoms, pelvic discomfort, and slower recovery after arousal. So here's how to correct it properly. If you're new to this, start gradually, avoid long sessions in compressed positions, and switch to standing for shorter durations, around 5 to 10 minutes, allowing your body to adapt. Then progress to a reclined posture with support under your lower back, keeping the hips slightly elevated and relaxed, ideally for 10 to 15 minutes. The goal is to create space, not tension, and over time this allows both blood vessels and nerves to function more efficiently. But even when your position is perfect, there's a deeper issue related to how fast you move through the experience, and that's where things begin to affect your nervous system in ways most men never consider. Mistake number 3, rapid stimulation response. Now this is where things start to accelerate, and not in a good way. Here's a simple correction you can try tonight. Slow everything down to at least half your normal pace and add one key element, controlled breathing about 4 seconds in, 6 seconds out, while you stimulate. It sounds basic, almost too easy, but this directly shifts your body from a stress-driven response into a blood flow-driven state. The central compound here is nitric oxide, and this is where most men get it wrong. Nitric oxide is what tells your blood vessels to relax and expand, allowing proper circulation, but when you rush, your body activates adrenaline instead. That creates the opposite effect. Vasoconstriction, meaning your blood vessels tighten and blood flow drops right when you need it most. Studies have shown that slower stimulation combined with controlled breathing can increase nitric oxide availability by up to 15 to 25% within minutes and reduce stress hormone levels by nearly 30% in under an hour. Now here's where it gets interesting. When nitric oxide is released properly, you don't just get better blood flow, you also get improved endurance and more stable performance. Many men report that within just a few sessions they notice longer-lasting response, less fatigue, and a stronger sense of control. That's because you're not forcing the system anymore. You're aligning with it. If you're thinking this feels too slow or it's hard to stay focused, that's actually a good sign. That discomfort means your nervous system is resetting, moving away from years of rushed conditioning. Start with just 5 to 10 minutes, keep your breathing steady, and let the body catch up instead of pushing it forward. And here's the powerful part. This gives you both immediate improvement and long-term restoration. You feel the difference quickly, but over time your entire response system becomes more efficient. But even if your speed is perfect, there's a deeper structural issue. Something most men have never trained in their entire life, and it quietly controls everything from blood flow to control. Mistake number 4, declining pelvic floor function. This one might sound unusual at first, but I want you to try gently contracting the muscles you would use to stop urination, hold for 5 seconds, then release slowly and repeat that cycle 10 times before any stimulation. It may feel subtle, almost insignificant, but this is one of the most powerful ways to restore control over blood flow in the pelvic region. Most men never train this area, and by the time they reach their 60s, those muscles have already weakened without them realizing it. Here's the deeper mechanism. The key compound involved is again nitric oxide, but this time it's being supported through muscular activation, which enhances both large blood vessel flow and microcirculation. When you engage the pelvic floor correctly, it improves the release of nitric oxide through endothelial signaling, while also activating smaller capillary networks that nourish nerve endings. Studies have shown that consistent pelvic floor training can improve erectile function by up to 40 to 60% over 8 to 12 weeks and increase microvascular perfusion by nearly 25%, which directly impacts sensitivity and recovery. Now think about the symptoms many men experience: numbness, delayed response, slower healing after irritation. These are not random. They are signs of reduced microcirculation and poor neuromuscular control. When blood isn't reaching those smaller vessels efficiently, tissues become less responsive and nerve signaling weakens over time. So here's how to build this safely. Start with 10 repetitions, holding each contraction for 3 to 5 seconds, twice per day. After 1 week, increase to 15 repetitions and gradually extend the hold to 7 to 10 seconds. For better activation, perform these exercises in a warm environment or after a warm shower when tissues are more relaxed and responsive. But avoid overcontracting or straining because excessive pressure can create the opposite effect and irritate the prostate. And once you regain control over these muscles, there's still one critical factor that can either accelerate your progress or quietly undo everything you've built so far. Mistake number 5. Frequency that doesn't match aging physiology. This may sound counterintuitive, but I sometimes ask my patients to intentionally pause for 3 to 5 days, then reintroduce stimulation in a controlled, scheduled way instead of following impulse. It feels unusual at first, almost restrictive, but this reset helps your body rebuild sensitivity and stabilize its internal rhythm. After 60, your system doesn't respond well to randomness anymore. It needs timing. The key compound here is testosterone, but not in the way most people think. Testosterone interacts with nitric oxide through intermediates like luteinizing hormone and endothelial enzymes, helping regulate both large blood flow and microcirculation. When frequency is too high, testosterone temporarily drops and inflammatory markers rise. When it's too low, blood vessels lose responsiveness and nerve endings become less active. Some data shows that balanced frequency can improve vascular response by around 20 to 30% within a few weeks, while extremes in either direction can reduce function by a similar margin. You may notice real symptoms: less firmness, mild numbness, slower recovery, even a dull ache that lingers. That's your body signaling imbalance. So start with once per week, observe how your body responds, then gradually increase to twice per week if energy and recovery feel stable. Evening timing works best when the body is warmer and circulation is naturally higher. Just be careful not to force a schedule if your body feels fatigued, because overcorrection can backfire. And even when your timing is perfect, there's still one final mistake, the most damaging of all, that goes beyond the physical and into something much deeper. Mistake number 6. Excessive mechanical force on sensitive tissue. This may sound surprising, but I often tell men to intentionally use less than half the pressure they think they need, even if it feels ineffective at first. In fact, for the first week, I recommend switching to a lighter grip combined with a warm compress for a few minutes beforehand, allowing the tissue to soften and become more responsive. It feels counterintuitive, almost like you're doing less, but biologically, you're restoring function instead of forcing it. The key compound here is nitric oxide, but when excessive force is applied, it disrupts the entire signaling chain. High pressure compresses blood vessels, reducing nitric oxide release, while also triggering inflammatory mediators like cytokines that impair both large vessel dilation and microcirculation. Over time, this leads to microtears, reduced elasticity, and even early fibrotic changes, which many men experience as numbness, reduced sensitivity, or slower recovery after stimulation. Some clinical data suggest that repeated mechanical stress can reduce local blood flow efficiency by up to 30%, while microvascular damage may decrease nerve responsiveness by nearly 25% over time. This is why men often report needing more force just to feel something, not realizing that the force itself is the cause. It becomes a cycle. Less sensitivity leads to more pressure, which leads to even less sensitivity. Here's how to correct it safely. Start with very light pressure, about 30 to 40% of your usual intensity, for short sessions of 5 to 7 minutes. After 1 to 2 weeks, gradually increase duration, not force, allowing the tissue to adapt naturally. Use warmth beforehand, such as a warm towel for 3 to 5 minutes, to enhance blood flow and improve tissue flexibility. But avoid aggressive friction or prolonged sessions, especially if you notice soreness, because that's a sign of micro-injury, not progress. And if you think physical technique is the main issue, the final mistake goes even deeper, beyond tissue, beyond blood flow, into something most men never consider, but it changes everything. Mistake number 7. Lack of psychological engagement. This may sound unusual, but I often ask men to pause completely for a moment, place a hand over their chest, and focus on slow breathing before any physical stimulation begins. No movement, no urgency, just awareness of sensation and presence in the body. It feels almost unrelated at first, but this is where the deeper system begins to reset. The key compound here is oxytocin, often called the bonding hormone, and it works in close coordination with dopamine and nitric oxide. When emotional engagement is present, oxytocin enhances parasympathetic activity, which allows blood vessels to dilate more effectively while also improving microcirculation to nerve endings. Without it, the body stays in a low-level stress state, limiting both large-scale blood flow and the fine capillary networks that support sensitivity, which is why many men notice numbness or a delayed response. Some observations suggest that increasing parasympathetic activation can improve vascular response by 20 to 30% in a short period, while consistent emotional engagement may enhance overall sensitivity and recovery by nearly 25% over time. You're not just affecting mood, you're directly influencing circulation and nerve function. Start with just 2 to 3 minutes of stillness before any activity, then gradually extend that time as it becomes more natural. A warm, quiet environment helps amplify the effect, as does slower breathing, but avoid forcing emotion or overthinking the process because tension blocks the very response you're trying to create. And when you combine everything you've learned so far, that's when the real transformation begins. If this video helped you see what might be quietly affecting your blood flow and performance after 60, consider subscribing so you don't miss what comes next. We'll keep breaking down simple, science-based ways to protect your circulation, sensitivity, and long-term vitality. Thanks for watching and taking this seriously.